Hello, my name is Dr. Kuheli and we have a very special announcement today. आज इस वीडियो में मैं वो बात बताने वाली हूँ जो आप लोग बेसब्री से इंतज़ार कर रहे हैं. That is, we are giving our iFit kit, the entire kit of eye exercises and vision therapy. In all the videos that we have shared of eye exercises, बहुत सारे कमेंट्स आते हैं कि कहाँ से मिलेगा, where can we buy this, where, how to do this eye exercise, how can I get this eye exercise. So let me tell you what all is there in the iFit kit. The first, the most important and the most popular is how to do a pencil push-up, उसमें convergence exercises. So today's video I'm going to show you what all is there in the iFit kit and who can use it and who it will not be useful for. So this is for convergence exercises. You can see the video of how to use this in my video titled How to Do Pencil Push-Up Exercises. You have to hold this far and use your finger or a pencil to do convergence exercises. This exercise is very good for people who have divergence, people who have intermittent exotropia or eyes going out sometimes, people who have convergence insufficiency or when they are looking past ka kuch near, they are unable to bring their eyes closer. So this exercise is very good for them. Who is it not good for? This exercise needs that both eyes should have good vision. So people who have only one good eye and other eye has low vision, which is amblyopia, they cannot use this. Now when I say amblyopia or good vision, I mean with your glasses. If when you wear your glasses, that is best corrected visual acuity, your best vision, जब आप चश्मा पहनते हैं, if that is in 6.6, 6.9 range, then definitely you can do this exercise. It is not that you have to do this exercise after you've removed your glasses. You have to wear your glasses and do this pencil push-up exercise. To see the exact video, I will link it below all the videos of the tutorial of how to use these. The next exercise is this chart, which is transparent sheet, and you have to see further away from this one. How to use this chart is there in my video, how to do 20-20-20 rule properly. This exercise is for relaxing the eyes. This is for people who have too much conversion and they need to diverge their eyes for far, who need to relax their eyes, where we want the eyeballs to go a little bit outwards. So that is where this is very helpful, especially for people who have too much screen time, too much near work, too much computer work or too much studies, where their eyeballs and the eye muscles are used for near work and they are unable to relax it. That is where this exercise is very good. Who should not or will not get help from this? If you have again amblyopia, again this one requires binocular vision, that is both eyes should be working, only then the red and the green will join. So you need to have good vision wearing your glasses. Who is it not very good for? People who have very large esotropia or squint eyes. People think that if your eyes are very squinted, you can do this exercise. No, they will not be able to relax so much. It will not happen that you can bring 40 prisms of esotropia corrected completely by using only a divergence chart. So definitely this, you might have seen कि बहुत सारे videos में कि it works for big squints. No, big squints need surgery. After surgery, if you want, you can use any of these charts. This will help to bring the eyes in, this will help to bring the eyes out. You can do both of them in tandem to help the muscles, to balance the muscles, but not for large squints. Even this one, it doesn't work for very big squints. After I have explained these two charts, we move on to the third chart. This is a red-green chart or binocular vision chart. This is done with using this red and green goggles. A pair of red and green goggles will also come in your iFit kit. When you wear the red-green goggles, the right eye can see only the right eye pictures, and the green left eye can see only the green symbols. Just come closer, let me show you. So you have to, after you have worn these goggles, you have to say if it's pointing outwards, up, which side is it open? Is it a E, W, 3, M, E, W, E, 3, M, W, like this, or which side is it open? And this is done by using the red-green goggles. Now, who can do this exercise? This exercise is very good for building your binocular vision, using both eyes together, because right eye will see something, left eye will see something. This is very good for people who have recovered from amblyopia, who have done a bit of patching and now they want to use both eyes together. So binocular vision therapy is very popular. You can do any number of red-green combination exercises using these red-green goggles. Once you have a pair of red-green goggles, this is one of the charts. Then you can use any combination once you understand the principle of using both the eyes together. This is very good for people who have slight difference in both eyes in their numbers, slight difference in their vision in both eyes. It can also be done for people who have small squints as well, and when you're trying to balance both the eyes together. This is not to straighten the eyes. This is to pick up the vision. So the right eye will see and the left eye will see, and so you are trying to make both eyes work together and see in the same direction. So this exercise is very good for that. This is binocular vision therapy. The fourth exercise is to build stereopsis. So the first exercise was to move the eyes inwards. The second exercise was to move the eyes outwards. The third exercise was for vision of both the eyes to work together. And the fourth exercise is based on stereopsis. How to use this chart, I will put a video of it and you can see the link below. It will be on my YouTube channel. Basically, it is about using your eyes together and building your 3D stereopsis for near. So these are your 4 charts. The next exercise is your Brock string. Again, the Brock string video is very popular on my YouTube channel. Many people don't know how to get a Brock string. So this is a homemade Brock string that we have prepared for our patients. One end will be tied to the end and the 3 balls will be there. This how to do this exercise is also on my YouTube channel, but there are a lot of YouTube videos of how to use a Brock string. So you can see those videos, how to use a Brock string, and we can send you the Brock string in our iFit kit. Then we have finished 1, 2, 3, 4, 5 different eye exercises. The next eye exercise is the Hart Chart. Till now, whatever exercises we were doing were for the muscles which are outside the eye, जो eyeball के बाहर है, extraocular muscles. अब next exercise is for your ciliary muscles, the muscles inside the eye which work on the lens. So when you have to look far, the lens has to flatten, and when the eye looks at something close by, we call it accommodation, and during accommodation the lens has to become curved. So for accommodation, this range of accommodation, so that the eye lens can flatten and curve, this kind of range of accommodation and accommodative flexibility of accommodation is for the Hart Chart. In this we will give you instructions. There will be one page which you will hold close by, pass me. One will be put 6 to 8 feet away. You have to read one line far, one line near, one line far, one line near. Then one word far, one word near, meaning one letter far, one letter near. What will this do? The lens has to flatten, curve, and this will help you to see far, near, far, near. This is what I had said, is very good for children in school also, because this will help them with the blackboard, to look at the blackboard, then copy the work. And this is very good for people who have continuously near work and they are unable to relax or accommodate their eyes for far things. So again, you have to wear your glasses and do this exercise. Close one eye, do for one eye, and then close the other eye, and then do for the other eye. This exercise is not for building binocular vision. This is for your ciliary muscle. We are also giving you red-green color differences, because again, red and green colors will get stimulated separately. You can do this red and green exercise using your red and green goggles as well. The next is a scanning chart. Now in a scanning chart, what you have to do is the letters A, B, C, D are given. You have to find the first A and cancel it, then cancel the next B, the next C, the next D. I may post a video of how to do this exercise, but it is very simple. एक paragraph में, in one paragraph there is A to Z, and you have to just go keep marking the A first, B first, then C, D. What this does is builds the concentration, builds your ability to scan the letters, helps reduce distraction, helps children who have a little bit of learning disability or unable to follow in a line, gives them practice of following in a line, helps them to trace, use a finger and trace letters. So it builds their speed of reading, it builds their concentration. It is also good when they are doing amblyopia therapy. When they have patched their eye, they can patch their eye and do this kind of exercise to build their eye exercising. So this is a scanning sheet. We have in each page 4, and we have given you 1, 2, 3, 4, 5, 16 pages. So a lot of practice can be done with this. You can take printouts of this as well. So at least lot of exercise can be done using the scanning chart as well. So this is your eye fit kit. You have 8 different exercises for your eyes, and you have understood ये किसके लिए है. अब I am going to clarify ये किसके लिए नहीं. A lot of videos are out there on vision therapy. A lot of centers are advertising about vision therapy, and people are saying that vision therapy से चश्मे का नंबर हट जाएगा. That is the first thing I will say. This is not some kind of advertising page. This is a doctor talking to a patient. So the first thing I will say is these exercises will not reduce your glasses number. Let me repeat it. These eye vision therapy exercises will not reduce your number. If you have a high minus number, very high minus number, very high plus number, they will not change. Even smaller numbers, it will not change. These numbers, these exercises will not change your astigmatism. If you have an astigmatic number, it will not change your myopia if you have myopia number. So this is not for glasses number. The second thing is, this will not cure dense amblyopia. If you cannot see anything in one eye, absolutely like your vision is 660 or 636, and you think that only this will help, no. These exercises will help mild amount of amblyopia, 6/9, max to max 6/12 vision hai, then these exercises are very good. If you have done good amount of patching and you have reached the level of 6/12, 6/9, I would highly recommend these exercises, which you can do together with your patching exercises. Some days you will patch, some days you will do binocular vision therapy. It's always very good to do these. But remember, it is not for dense amblyopia. No. The third people who it will not help is very big squints. Small squint. What do I mean by small squint? Anything less than 15 diopters. Less than 15 diopters, you can always try vision therapy. Intermittent squint just once or twice a day, only when you are tired. In those kind of squints, yes, you can try vision therapy. If you have a very large squint, 40 prisms esotropia, 40 prisms exotropia, because I have seen that most of the patients who are doing vision therapy exercises have very large squints. No, those squints need surgery. They definitely need surgery. After we have done the surgery, after that, if you have good vision in both the eyes, then definitely you can do these exercises. These will help to keep the surgical results better, and the results of the surgery will last you longer life if you have done a certain amount of vision therapy. But do not expect that just on vision therapy you can correct very big squints. Now, why are we giving this entire eye fit kit to all the patients? This is because I really want patients to feel empowered. I want them to feel that yes, I know exactly what is going on and how I can treat myself, because a lot of people are just blindly following all these some eye drops, some Baba, some ashram, some kind of clinic, and they are not following the clear scientific doctors, really evidence-based teaching. And that is why I want this to be clear. This is from a doctor to their patient. That is what I wanted to say. So this entire eye fit kit we are giving at the cost of 2,000 rupees. It is inclusive of your postal charges. We will mail it to any part of India. All the instructions will be there. We will also give a page in which all the YouTube videos we have, as you know, the YouTube videos of how to use these will also be there. You can expect that if you want to get more clarity on how to use them once you have ordered it, yes, there is a possibility of doing a video consultation once you have got your eye fit kit as well. I hope this video has really, so do not think of this as a toy. Think of this as a consultation with your doctor and a therapy and a kind of an exercise, a therapy and a medical thing that you are doing for your eyes. So I am very happy to bring the eye fit kit to you. Now, how can you order your own eye fit kit? It is very simple. You just have to send a message to 830-830-9418. Do a Google Pay or a Phone Pay transfer of rupees 2,000. Send your address and we will ship it to you, including all of these 8 objects as well as instructions, as well as a page which has all the links to all the different exercises. Either they will be my own videos or excellent videos from YouTube which will explain to you all of this. So all the videos will be there, up to 15 videos will be there. You can watch the videos and then do these exercises. And definitely this is a way, a celebration, a service from Dr. Kuheli to her patients all over India. We have so many people reaching out to ask how to do the eye exercises, what eye exercises to do. Well, this is the entire set. I hope that you like this video, and please comment below if you want this eye fit kit. We are really looking forward to serving you. Thank you.